active, and they want to see that the more improvement comes to the students of homeopathy. Now see, ours is a subject or Organon, which is considered to be the soul of homeopathy, right? And what I feel is that right from the beginning, Dr. Hahnemann himself has introduced this word dynamic. He himself has introduced this way of evolving. If you read the first edition of Organon and you read the 6th edition of Organon, there is so much of involvement. Like chronic disease, miasms, you will find in the first edition of Organon, which is right now our lifeline. Because people come to homeopathy for chronic diseases more. And so we are surviving in this competition. Right now there is so much competition in the world of medicine. And still we are surviving because we are good at treating chronic diseases. So now this concept of miasm came in the 4th edition of Organon. Which was published in 1829, as you all know. And so it was almost after 40 years of practice. So he himself was changing. He himself was learning. He himself was understanding. And we teachers of Organon, we are staunch followers of Dr. Hahnemann. That is what we could say. In all other subjects, we are the ones who are the staunch followers. So this is not something new which has come. Though it took so many years to come in homeopathy, in the morning session you learned that we are the first to implement it. Still medical colleges have not implemented, Ayurvedic colleges have not implemented. And I have heard teachers say कि medical college वाले नहीं कर रहे हैं तो फिर हमको क्यों करना है? हम क्यों ये अपना फोड़ रहे हैं? क्यों हमको ये टेंशन दे रहे हैं? But see, it is somebody has to be torch bearers. And when we are torch bearers, we are going to be the first. हमेशा क्या होता है कि जो first आता है उसको ही लोग याद करते हैं. जो अभी बिजनेस कोविड के साथ हुआ. That we all feel sad about it, right? Though we know that she had given her 100%, but she has not got the gold medal. So we all are feeling sad about it. So that makes a change. That marks a change. So this is where we are going to lead the other fields of education. Itself we should feel proud of. Now, what I said, Dr. Hahnemann, all of you must be knowing this, that in the first edition of Organon, the stanza which he had taken, the truth we mortals need, us blessed to make and heed, the otherwise slightly covered over, but did not bury me. We teach this to our students. Now, from that also we can understand that Hahnemann himself was trying to say that whatever is beneficial, whatever is truthful, whatever is needed, whatever is like a blessing to mankind, which helps to maintain our life, is just within our reach. It is not buried. You put a little efforts and you reach to it. Same is with the implementation of this curriculum. That little effort now after first year, or today I saw in the last session, some of the principals were there and they told that after first year, now CBDC seems to be very easy. Because first year if you have not, ये सब क्या है? Pillars pyramid क्या है? What is Bloom's taxonomy? What is Gilbert's level? So these were the things which we used to feel something which is foreign and which we resisted, that we don't want to understand. But now, because NABED came and NABED has implemented all these things, we Indians are like that. If it is mandatory, we do it. Otherwise, we don't do it. So for Indians, it is said कि वो जब rocket में वो पीछे fire होता है तभी ऊपर जाता है. Otherwise, नहीं जाता है. So it's like we are like that. So now we had to implement. We had to prepare our lessons plan according to that, and so we have started doing it. So these are the things that once you implement it, it will become more and more easier for you. So this is the thing. Okay, so now we start with the basic thing. I feel that the morning session which you all attended was quite helpful. The majority of the portion, like drawing of the question papers and everything was covered. So majority majority of the things were covered. Just we'll now go how to implement it in our teaching of Organon. So this is what we are going to do. Now see, this already you know. Organon of medicine with homeopathic philosophy are central fulcrum. What I said, it is the soul around which education and training of a homeopathic physician revolves. It not only elaborates on the fundamental laws but also how to apply them in practice. Now see, this is, we are doing it in Organon right from the beginning, from the first edition of Organon. If you see the classification, the ground plan of Organon, it is the doctrinal part and the practical part. 1 to 70 aphorisms, the doctrinal part, the whatever is mentioned in the doctrinal part, the knowledge of disease, the knowledge of medicine, it is then again explained in the practical part of Organon, right? So we have already done it, because what is the final goal of CBDC? To make your students usable in this society. That is the final goal. It is just not knowledge. It is along with the knowledge, the skills must come, right? Skills, they must, because see now in India, there are so many engineering colleges. Yet if you see, it is a very well-known fact that in the engineering colleges, the engineers which come out, among them only 10% are usable in the society. Other rest 90 have to be trained again. So they are not trained and they come out. So this is the reason that why we have implemented this. And all of you must have faced the QCI inspection, right? QCI हो गया सबका. तो आपने क्या experience किया? How it has changed? Previously it was all documentation which was checked, rechecked. Now it is interviews with the students. It is interviews with the teachers, the interns. If you have got PG students, they are made to do things practical, right? So the skill development. So in Organon, right from the beginning, it is there in our Bible that we have to teach the theory and the practice of it also. So this is the implementation of the theory into practice. This is again the goal of CBDC. It defines the qualities of the healer. So see, these are the qualities. Like if you see the aphorisms of case taking, aphorism 83, 84, 98, where Dr. Hahnemann has said that how you behave with your patient, with your gestures, with your expressions, with your way of talking. Keep silence, allow the patient to talk. Talk to the patient if there are certain things which you feel that the patient will not answer in front of everyone. Then you talk to the patient separately. See, all these things, that is why I always feel that CBDC is already there in Organon. I always feel this, that all these things that you have to become a good healer, which is given, Hahnemann has given so many aphorisms related to this, that how you can become a good healer. So this is the goal, this is the preamble. In the morning, if you remember, Pune sir had shown different topics which are to be covered. I'll be also showing it. But this is the preamble part, the first part, which is about what exactly you want your students to learn by the teachings of Organon. So this is the preamble. The same thing, the concepts and knowledge required by the physician with operational knowledge of management of patients and their disease will need horizontal and vertical integration. Now see, later on we come to what is horizontal and what is vertical integration. There is one more integration, that is spiral also. So we come to it. And second year BHMS, or it can be third year, fourth year. This is the integration of various subjects also. In second year it will be pathology, forensic medicine and materia medica. So we come to it in detail that how they will be integrated. Now as you know, you must have gone to the website of second BHMS and you know that the lectures, the theory lectures will be 150 hours and 100 will be the non-lectures. We come to it that what will be the non-lectures. One after another we'll explain. So you want to take a picture. So this is, it will be 150. It is already there on the website of NCA. The will be the lectures, how it will be divided. Now see, these are the various competencies. Which we are going to implement in second BHMS. Now here it is a learner-centric. See, learner-centric philosophy, statements of competency, structured syllabus. If you have remembered in the morning, Sir was talking about learner-centric teaching. Now here, see, when we are using the word learner-centric, means it is focusing on the student, individualized teaching. This is the difference which is coming. Where in the morning Sir had given the example of a mobile tower and your mobile being switched off. So the student is switched off. So no matter whatever you are transmitting, it is not registered by the student. Now this method of teaching is not transmission, it is transformation. So here we are going to concentrate on each and every student. That is the reason the periodical assessments have come. The marks of their periodical assessments are taken into consideration. They have to do the electives. Only if they have done the electives and the periodical assessments, then only they are eligible for the final exams. So this is a student-centric teaching. By this student-centric, it is, see, this is the difference, that we don't have to finish the syllabus. We have been given 1 year. 1 year, these many aphorisms are to be completed. These many chapters from the books of philosophy are to be completed. And so we go to the class, we narrate whatever we know, and we don't bother to see what the students have understood. So this is the reason that we first go and we tell about what are the learning outcomes, and at the end of the class we see that those learning outcomes are achieved or not. So that is known as student-centric. By this, they develop their own identity. When it is student-centric, then they develop their identity, and when they develop their identity, then they know that they are homeopaths and they have to have this much knowledge, this much skill, this much cognitive skills, and then only they will be able to practice homeopathy. So identity development is by student-centric teaching. What is identity development? That they develop their identity as physicians of homeopathy. They have got that confidence that they are supposed to practice homeopathy, they don't have to go anywhere else, and they are supposed to teach and practice homeopathy. It may be teaching, it may be practicing homeopathy. But this is what is known as the student-centric. Then we have got as I said, the details of learning outcomes. Now see, course outcome and learning objectives or learning outcomes. What is the difference? You must have done it in first BHMS. What is the course outcome and what is the learning objectives? Yeah, at the end of the entire course, what the student must know is known as the course outcome after 5.5 years. So that will become your course outcome. Your learning objective is for each topic or each lecture you can say. Or you can say one aphorism also. Or you take say 9 aphorisms together if it is the same topic. Or say if you are teaching by two. No, the sum of the portion did not come. Now I've skipped that slide and I've gone to the previous one. Because they say that there is too much of data, so it is getting many. So anyway, I've started with the next slide. If there is any issue, ma'am, you will stay over here. Otherwise, again, our lecture will never halt. So this is, see, that is the learning objectives. That from each lecture, each topic, group of aphorisms, one aphorism, what the student has to learn. So that will become the learning objective. So in CBDC, we'll see to that also. Specific instruction and assessment approach, what we studied in the morning, the summative and the formative assessments of the students. So how we will be doing the formative, summative, already sir has explained that in the formative what type of questions will come, in the summative what type of questions will come. So that is what is we will be studying. Then blueprint of learning and assessment. Blueprint means we know that these are the questions and these will be the topics and these will be the must to know, the better, the desirable to know. So that will come to how the blueprint or the question paper will be formed. The specific questions and specific topics to be covered in the question paper. Then there will be a planning of the clinical and practicals which you are going to take. So for the entire year, you will plan, you will have your lesson plans. Of course, the examinations and learner accountability. Finally, is just like student-centric. This is learner accountability. What is learner accountability?
They are responsible.
Yeah, they are responsible. See, we give all these, we go in a very structured way. Then it is the responsibility of the student that at the end of all the teaching, they must have that confidence of practicing homeopathy. They are accountable to the fraternity, to their teacher, to their college, and to homeopathy. They are accountable. That they are supposed to come out with all the knowledge and with all the skill. So that is becoming the end of everything is students' accountability. That they will practice homeopathy or they will teach homeopathy. Now, the different headings of the syllabus, preamble, which we already did previously. I told you that this is the preamble part. Then we studied what is course outcome at the end of 5.5 years, what the students' knowledge and skill must be there, both the cognitive and the psychomotor skills. So that will be their course outcome. Learning objective, already I said that after the end of your lecture or end of your series of lecture, like say for example you have started vital force, then vital force in health will become one learning objective, vital force in disease will become a second learning objective, the different attributes of vital force will become another learning objective, vital force in cure. So all these will become your learning objectives. So you can see it is up to you. Some of the topics you have to divide syllabus wise, some of the topics you have to divide lecture wise also, or it can be aphorism wise also, or according to the books of philosophy. So if you are teaching case taking, then it can be divided, the learning objective can be for a long period of time. Like it can be from Organon aphorism proper, it can be from Dr. Penn's philosophy, it can be from Stuart Claus, Roberts, or all together also. So that is how you decide. Then of course the teaching, the course content and term-wise distribution, how the syllabus will be distributed in both the terms. The teaching hours which already this thing has given, LCH has given to us, so we are supposed to cover it. We see to it that the content is properly mapped. Mapped means it is very, very comprehensible. Content mapping. Anyone knows what is content mapping when we ask the students to do it? Content mapping. See, it is like forming diagrams or making flow charts. Flow charts. That is content mapping. You make a flow chart. That in first term, this topic you have taken, like say for example, in first year you have taken the first aphorism. Then it will be taught from Organon. Then in philosophy, the sixth. So that is, you draw a map or you draw a flow chart and you decide. So it can be diagrammatically also it can be presented, or it can be presented in a form of charts or flow charts, like what we have got classification of disease. See, the content is for many aphorisms. But if you draw the classification of disease, then you come entirely to know that what will be the content. So then it will continue for many other aphorisms. So that is content mapping. According to the topic, you will decide what will be the teaching learning methods. According to your topics, what method or media you are going to use. It is not only method, it is media also. So that will come across which are the different types of teaching learning methods, and details of assessment, that is summative and formative, and finally the list of recommended books. Now this again you have got ready-made because LCH has already proposed that you are going to refer these many books in second page, third page, and fourth page. So the recommended books. Now course outcome, at the end of the, we have already discussed it, at the end of the BHMS program a student will be able to understand what is the course outcome. So I already told that at the entire BHMS is over, what the student must do. So no need to read it, we are already teaching this. So that will be the concept of vital force, dynamics, the holistic concept of homeopathy, why individualization is needed, why we individualize a patient. So these are all the course outcomes. And continuing about, so this is what the aphorisms we teach. It is all about the aphorisms as well as the books of philosophy. So that will become the course outcome. Learning objectives which the student must know. That is, this will come under must know. So the learning objectives, classification of disease, because see, this is what they are going to put into practice. This is what they are going to practice in their whole life. So making the portrait of disease or the totality of symptoms, analysis and evaluation of the symptoms. So this is what they are going to do. Now see macro teaching and micro teaching. In the morning it was mentioned that there is a macro teaching and then there is a micro teaching. So just now what I gave you an example, that classification of disease as a whole, when you show the mapping, then that becomes macro. Now in classification of disease, when you take acute disease, and when you teach acute disease aphorisms, when you teach them what is an individual acute disease, what is a sporadic acute disease, what is an epidemic, what is a pandemic, what is an endemic, then it becomes micro. Whatever it means, classification of disease, like it is, first is macro, the entire classification. Now in that you make cards and you teach them. That becomes the micro teaching. Now here already NCH has given us how to divide the hours. See, they have made our lesson planning very easy. That for say natural diseases versus artificial diseases. So that will be 5 hours. So this is there. So these are the division of the hours for macro planning. Now see, macro planning, this will be very helpful to the teachers in forming their lesson plans. These are the hours which are distributed. Depending upon the number of teachers you have got in your college, if it is a PG college, you might be having 5 teachers. If it is an UG college, you might be having 3 teachers. Some colleges may have more teachers, some may have less also. So depending upon the number of teachers which you have got, you will divide these hours. So this is nothing to explain. This is the common hours which are given. Now say natural disease versus artificial disease, 5 hours. This is macro. When it comes to micro, then natural diseases versus artificial disease. Artificial diseases are stronger because they are unconditionally. They are for each and every individual. The dose and potency is in our hand. It does not depend upon the time, or it does not depend upon the susceptibility. This will become micro. And what aphorisms are given, I think so 3 aphorisms are given. So each aphorisms, it will become micro. So that will be, this is just one example. I gave you the example of classification of disease, also elective disease. So this is just examples. These are all macro teachings, how the time will become. Say for example, record keeping. This you teach from Organon also, and you teach it from Kant's philosophy also. So 1 hour you may take it from Organon, 1 hour you may take it from Kant. Now say in some topic you may feel that you want to give more, then it can be compensated with other topics also. Say record keeping, in 1 hour you have taught both, like you have taken more lectures for case taking. So record keeping, you have in case taking you have already explained about the follow-ups also. So record keeping is more of follow-ups. So you may give less hours to record keeping, and your micro teaching may keep on changing. But the macro hours, if you try to stick to those macro hours, then at the end it will not be that you have missed something in your syllabus. So it is very important that you stick to the hours of macro teaching. Okay, now we come to the non-lecture activity, term time allotted or activity. Now see, this is how the non-lectures. Previous, or you can ask it. Ask.
For example, there are 20 hours given for the aphorism of case taking from 83 to 103.
Yeah.
Now, some aphorisms are just about 3 lines, 4 lines. So we tend to finish the aphorisms not in 20, but sometimes in 10, sometimes in 12 lectures. So those 8 hours extra, can we give it to the different? So it's very flexible that way.
That is what I want to do. Micro teaching is in the hands of the teachers. You can compensate. Macro, you see to it that you follow the hours. But say you have saved 5 hours per year, you can use those 5 hours in other place. Now say, sir, it may happen that in case taking, that say you give some examples, you give your case to the student, then it may take more hours also. Case taking, it may take 20 hours. I feel 20 hours or less for case taking. Because when we teach case, when we teachers of Organon, we teach case taking, then you must not interrupt the patient, only interrupt when he goes to another story. So you may give examples that how the patient can go to another story. So you can give. Then the positive factors, how to form the totality of symptoms, analysis and evaluation of symptoms, PQRS, how to identify the PQRS. So sometimes it may happen that to identify the PQRS, you are giving so many examples, or you are discussing some case also. It may be a case in your OPDs, IPDs, or it can be a case from your private practice. And during case taking, you start explaining it also. So this is micro. I said that you can compensate according to the time you have taken. Macro, why I am telling you stick to the macro. Say 1 or 2 hours you are doing this way or that way, it's okay. But stick to it so that at the end the syllabus is completed at the right time. You don't have to rush, or you don't have to leave the syllabus. Itna nahi ho paya. That may not happen. Yeah.
hours. But I have not understood second point in theory lectures, the correctness of therapeutic law of nature. 20 hours has been allotted. So already we have taught therapeutic law of nature in first year. And now I found very much difficulty while making lesson plan for 20 hours for second.
See, 20 hours, why they are allotted? If you take all the aphorisms, what happens when two dissimilar diseases come together? Then there are 9 aphorisms. 9 aphorisms with examples. So you have to explain the students that in nature what is happening, from where he has taken the illustrations, and then if you give a medicine, if you give a dissimilar medicine, and what will happen to the patient. Then there are aphorisms, what will happen when two similar diseases come together. So there also I think so there are 6 aphorisms. So yeah, then only you can prove the correctness of the therapeutic law. And when what happens naturally when two similar diseases come together, Dr. Hanuman has given 2 aphorisms only for examples.
Yes.
He has given all examples of ophthalmia and that purification of the arm. So there are so many examples. There are so many examples.
First year lesson plan and second year lesson.
Difference. Ma'am, of course, these will be the topics which will come in second year. These aphorisms will come in second year.
Just for is the
It's not included. Only see in first year you have only taught the therapeutic law of nature. Now the correctness you are taught teaching them in the second BHMS. You have not taught in first BHMS. Now you are going to teach. So you just mentioned them what is therapeutic law. Then you have not done anything. After that you have not done anything. So now you will be doing it.
Like we said, we are taking lesson plans. Now, if we are sticking to the macros, that is 20 hours. For example, for this particular topic, 20 hours are being given. While taking our lectures, now we prepare lesson plans for the same and then we stick to the lesson plans and we deliver the lesson plans the way it is.
Yeah.
But like what difficulty I faced in my first year was, I could not stick to the hours that was given. Certain topics I finished earlier, I mean in a less span, and certain topics needed a little more span. And then I made my lesson plans according to the hours that I took the lesson chapters.
That is not a lesson plan, that is your lesson diary, which you prepare.
Yes.
And how you have taken, that is the lesson diary. This is not the lesson plan. Lesson plan is something which you prepare in the beginning of the year, and you are going, it is a tentative plan which you are going to implement. Say on today 8th August 24. Please listen, sir, please listen. Sir, if you have got your inputs, you can give, sir. 8th August, you have decided that I am going to teach this topic. Now it rained very heavily and the college was closed, so you couldn't do it, right? So, lesson plan it is already written. But instead of 8th, you taught on 9th. So, in your lesson diary, which is yours, individual, you will write that this topic, 9th of August, you have taught. So, it may happen that what was written in the lesson plan has not been implemented. But it's okay. It is implemented on the next day. Because see, here you can't say college may remain closed. You may remain absent. You became sick, something in the family, or some holidays also. So see, lesson, I'll tell you one thing. First, let me clear it. Lesson plan is something which we plan for the entire year. Lesson diary is for each teacher to be maintained. That on what date, what this in lesson plan it is written that Dr. So and so is going to take vital force. Barabar, and these are the dates, these are the months which is given. Yeah, and
in our inspection, they have asked us that this day you have taken the topic of vital force, show this in the lesson plan. So that lesson plan got based on that day. Lesson plan got
and instead of this,
aspect to all this that is happening. So isn't it defying the purpose that we are making the lesson plan at the beginning of the year? We don't know what the dynamics will happen in the class. It might be not just on the teacher side, on the student side also. Sometimes they come up with such a doubt that the entire lecture goes in their correction of that doubt only. So if we are going to make this at the beginning of year, before they are starting on second year to start with few of the batches, we have certain time.
See, ma'am, what did I tell you? That lesson plan is something which you are tentatively deciding that this is what is going. See, it is like our Hindu calendar. That in August, we already finished the See, macro planning is hours only.
But that cannot be also for a single.
That is what I told sir, that macro planning, try to follow as much as possible so that your syllabus is completed. There can be compensation here and there. That is what I told. See, when you are making compensation in micro planning, then naturally it is going to affect the macro planning. It is going to affect, right? But see that you stick to it. Like if it is 20 hours, you can go to 22, 23 hours, but next which is 8 hours, you try to see that the 3 hours which you just got there, so it is an adjustment. This is just common. This is a common application. Because see what is given on the papers, word to word cannot be implemented. Like if I teach first aphorism, I may teach in a different way, you may teach in a different way. So I may teach first aphorism for 2 months. And some very junior teacher with some language problems or with less of experience, less of knowledge, may finish the first aphorism in 1 hour also, in 1 lecture also. So it depends upon your class also. See, teaching like learning methods. The first thing is that the capacity of your class. Kitne bacche hain? What is the response of the class? What is the teaching method of a teacher? So accordingly, it keeps on varying from person to person, from college to college, and from student to student. So this is, that way you have to make it applicable. Follow? So this is what is, that you don't stick at 20 means 20 सारी किया, वो फिर नहीं खत्म हुआ तो 20 सार हो गए तो हम उसको निकाल दें, ऐसा नहीं हो सकता है. Okay, now these non-lectures. Now see here. Clinical, all of you understand what is clinical teaching and where you will be integrating in second year pathology, practice of medicine, surgery and gynec also. The disease per se, 72 aphorism will be correlated with pathology, will be correlated with manisms. Then of course practice of medicine, the clinical picture of each and every disease. If the students knows the common symptoms, he will be able to identify the uncommon symptoms. So that is how you can correlate. So this is the various correlations. Then demonstrative means you do it and show it to your students, and they will learn from the demonstration. Seminars and tutorials. Now see, here I have seen many colleges there is a misconception. Tutorials are not for all the students. They are for the students who are weak. So it is a small group of teaching. Where a small group you are teaching. So those are the tutorials. Very few students you are teaching. And those who are weak. Now see, now we don't tell them slow learners. Previously they were known as slow learners and fast learners. Especially in NEC. I am a NEC assessor. So we were using these terms. Now they are the progressive learners. They are not slow learners. Progressive learners, profound learners and proficient learners. The fast learners are the proficient learners. So we don't insult anyone that you are slow and you are fast. So they are the progressive learners, the profound learners and the proficient learners. So now in these progressive students, let's say they have failed in the class test or they are failing in the periodic assessment. These small batches of tutorials which are there and they are given training or they are given classes. So it is a student-centric teaching. See, student-centric which I mentioned in the previous, in the beginning, that it should cover everyone. Okay. Yeah.
Specific to my college, I will speak now about this progressive learners.
Yeah.
Now, because Organon we deal with language, students especially come generally for performing well in organs. That is the thing that I find in my college and all of cities quite difficult.
Then you'll have to take the whole class again. See what in our university we have started a classes of English, proficiency classes of English, which is after the college hours. So you can have some other things also. This is the efforts of your management, efforts of your teachers, that we are doing communication skills, different classes we have started, and we give them certificates also. And these CMEs, we call them CMEs. These CMEs are to be done after college hours, not during the college hours. So some means you have to find out. But usually tutorials are for small groups, yeah. Please don't talk.
Tutorials are being created by the department. It has to be during the college hours, it has to be apart from the college hours. During the college hours. And if there are no progressive learners or progressive students, so then those things can be named as seminars. If tutorials, as you mentioned, that it is for students who are progressive. So if we don't find anybody progressive, everybody is having good proficiency and everything, then those things have to be converted into seminars. Okay. Seminars.
And you can initiate there for different competitive exams, for debates, etc. Those who are proficient. Actually, they give money. Tutorials can be like, say, the student is taking one subject and the other student is taking another subject. Or you can make it a library period. Or those who are proficient, you can train them for STSH. Like you are not teachers and you ask them to prepare a synopsis for STSH. So you send them ahead to run the competitions. अगर उनको CCRH का भेजना है, STSH is a program. There is lots of disturbance. Lots of disturbances. Finished? Everyone finished? Water taken? Pani de diya sabko? Sign करता है.
Ma'am, then what is assignment?
Assignment is something which you give to a student individually. To do an assignment means you are giving something individually. That you prepare something or you write something about some topics, like write a topic about emotions. You can give anything, so it can be an assignment. So that is, see, assignment is for a short period and it is individually given. Project is for a long period and it is given in groups. That is a project and that is an assignment. Okay? Okay, what is this problem-based learning and case-based learning? Anyone, what is problem-based learning and case both?
So you are telling the students about creating a situation about some problem, and then you ask the solutions from the students of how would you approach this particular
Situation. And case-based?
Then you get the case.
And then they give their inputs on that case. So problem-based learning is a method of teaching the subject by giving a situation and they will work in groups and find out the end solution. They find out the end solution also. Like say for example, if you say that difficulties in eliciting the mental symptoms. During case taking, difficulties in finding out the mental symptoms. So you are giving this as a problem. And then the students are working either individually or in groups. Usually it is in groups. And each one is finding out, each group is finding out the solution. Or the problem is that explain how inductive logic is implemented in finding homeopathy, growth of homeopathy, construction of homeopathy, case taking, drug proving, how inductive logic is applied. So that can be the problem. Then they have to find solution. Then they'll talk about correct observation, correct interpretation, rational explanation, and experimental verification. So for all different situations, they will show you that what was the observation, what was the rational understanding, interpretation, what was the rational explanation, and what is the experimental verification. So that is problem-based learning. Case-based, you can easily do it in your OPDs and MPDs. Assignments we have already discussed. Symposiums. You must be doing symposiums. Symposium is that it is a common topic which is presented by different speakers. Like say you give them diabetes, and say you have kept a symposium for all classes. Then the first year student may present the anatomy of pancreas, the physiology of pancreas. The second year student may present the pathology. The third year student may present the materia medica, the therapeutics. The fourth year student, the clinical picture, practice of medicine, and Organon. So that is how is, if you have got PG, then repertory also will be presented. So one topic and everyone is presenting. That becomes a symposium where there are many presenters. Or if you take a topic of their class only, then different speakers are presenting it. And of course group discussions where you separate the students into group and each one is given a task and they will perform that task. So these are total 100 hours. Then this is just the example which I gave you, macro and micro teaching. This is a sample which is prepared by me. Then lesson plan model, that picture is not shown, I have made a picture of it. Now see, we come to the basic thing, the competency-based dynamic curriculum necessitates that each topic in a course be elaborated in terms of the outcomes that are to be achieved by the learner at the end of the particular topic. This in turn will help the learner to achieve the competencies and the course and overall at the program level. Self-explanatory, I think. So since morning we are listening to this only, that competencies is the knowledge and the skill to perform that knowledge. Whatever knowledge. See, when we say this person is competent, means it is capability. That it is the capability of that person. Then he is able to competently do it. So he is able to do it. And when we say competency, then he is able to do it well. And it is a judicious use of his knowledge. It becomes a judicious use of the knowledge. The word judicious again from Organon. Yeah, that it is third aphorism. It is the right way, rational way of using your knowledge, which at the end is a skill and it becomes your day-to-day habit. You do it skillfully every day. That is a competence. You do it skill. Like say for example, you are driving every day. Then you become such an expert that without any application also, your reflexes are such that you will drive skillfully. So when it becomes a day-to-day habit of doing well, then it is called a competency. So this is what we have already. Now see, this is wherever I have written examples. These are the ones which are prepared by me. So there are no need to take pictures of it because this is not mandatory. If at all you are taking pictures, you can use it because this is not on the website. So therefore I have written examples everywhere. Now see, if you are trying to divide them, as in morning also sir said, to know how, show how, and does. Right? See, I've written example. So this is not mandatory. This is something which, just to simplify, I have prepared. Miller's pyramid. To know means to recollect, to remember, memory. Then to knows how the whole procedure is going on. So interpretation. First it is just knowing, now it is understanding.
Now you can just get little aside.
मेरा picture नहीं लेना है. You don't want me to come in the way.
Your work is more fascinating.
Yeah, if you want to take, you can take. But it is just, this is an example. I have taken only one topic of our second BHMS. And I have just divided what is Bloom's according to Bloom's cognitive, psychomotor. Cognitive means knowing, psychomotor means doing it, and affective means doing it every day. Implementation, problem solving is affective. And in Dilbert's level, see Dilbert's level in morning also sir told you that we have divided, we have taken to make it simplified by WHO. This is simplified, that is we have divided Dilbert's level only in the cognitive scale. The others we have not taken. The psychomotor and the affective are not divided according to the Dilbert's scale, Dilbert's classification. We have divided only the cognitive ones, and the cognitive ones, that is level of entry, then intermediate level and final level. So that way we have divided, because this is a division given for medical education by WHO. Otherwise, according to their mindset and their culture, there are many levels, but they are not implemented uniformly and universally. So WHO for medical education has given only this one. So these are the different domains, these are the different competencies on which you are going to teach and assess your students. Follow? Case records is case records. Case records. The bunch of cases is known as case records. This is a picture which you can get it. These are the Miller's classification, Miller's which we already have studied in the morning. Who knows how it shows and does. In the morning also sir had taken it in detail. This is just a repetition of it. Now the appropriate teaching learning methods which we are going to use. Now see here, the teaching learning methods and media have, here I have used the word media also. So methods is something what the teachers and the students do. That is methods, and media is something which we show to the students. So specific learning objectives formed for each topic and for the domain of each of the specific we have already discussed. The teaching learning methods and media will vary as per the specific learning objectives, SLOs and the domains. See, in the morning session, you have learned about this. How to decide the teaching learning methods. Sir had given the entire classification depending upon your class, depending upon your topic, depending upon the teachers. It was discussed. And there is one DOW, demonstration, observation, assistance and performance. This is what you are going to do. Demonstration, observation, assistance and performance. Miller's pyramid. This is nothing but Miller's pyramid. Knows how, shows how and does. So this is our basic things. Now lectures. The theoretical part. There are lectures and non-lectures part. We have already discussed. Lectures, small group discussion, integrated lectures. So this is again which we might not be doing. It is also known as team lectures. Or more than, there can be 2 teachers or more than 2 teachers also. Like say for example, if I am teaching miasms, simultaneously the pathologist teacher may be with me only, and he or she may teach the pathological aspect, the pathogenesis of a disease, and I may teach how the miasms are evolving. So it can be a team lectures, that is integrated lectures. In that way there can be 3 teachers also. That if one is teaching the Organon part, another is teaching the therapeutic part of it, and the third teacher is teaching about the pathology. So there can be an integrated approach of team teaching also. So these are the different ways in which the lectures can be taken. As I said, the assignments, like you give Soramaism and you give assignments to the students individually. One will write about the evolution of Sora, another will write about the characteristics of Sora, one will write about the different denominations which are given to Sora. So it can be assignments, it can be projects, then library references. You may ask what you were asking, that if few students are in the tutorials, what the others will do. So you may give them different journals and they can read that journals and they can present it also. So that maybe,
Ma'am, this concept is called a journal club.
no, journal club is a different thing. This is just library references. They may go to the library, they may start using the library. So this is, you can introduce this also. Journal club is completely different.
Can you elaborate please?
That is for PG students.
No, we have that part in first year CBDC.
First year, there see what we
For psychology.
Psychology. Journal club is like, there are different journals of psychology. Now you can't cover everything. So for your college to identify that these 5 journals or 10 journals, you will be taking as reference. And then you will ask the students, you can make them in groups or you can ask one student also, that they will read from that journal. Say they are reading a case, then they will read from that journal and then they will be presenting. So if say you have taken a group of students and you have given them one journal to read, then every week that group means this week group A, next week group B, C and D. So group A, introductory part one student will explain. Then say the proper better another student. So they can, like, there is a group of 20 students and out of that 5 are presenting or 10 are presenting depending upon that. So that is known as a journal club where regularly they read the journal and present. Thank you. Both you can give. See, it is the same. But it can be, your lecture today, you have taken this lecture and you give assignments to it. It's just like homework, what you are doing in schools. So it is no lecture also as well as lecture also. That today I have taught you this, tomorrow you do this much and show it to me. So that can be, I have taught you about the characteristics of syphilis. Then tomorrow you write down all the characteristics and you show it. Or some of the aphorisms I make the students do that they have to learn by heart. Therapeutic law of nature, the first aphorism, second aphorism. So write it and bring it. So that can be assignments.
It is very difficult to exactly the result.
Right?
अभी
photo मांग रहे हैं. That is the, they feel that we are all they are all dishonest. I would say teachers or we are dishonest. We are dishonest. So there is even practicals. I have seen that many colleges that even they said they gave the attendance of practicals and it was told them that what is the proof that you have done the practical. So now I have made it in my college that take videos of all the practicals. Whenever you conduct a practical, take the videos. And the teachers
for 4 years, madam. For 4 years, Organon, we have maintained for every lecture, every tutorial, every they may, madam, in my college, they have asked randomly, show the proof of this practical or clinic. How it is possible? That is my suggestion is for this. There has to be a QCA and this has to be correlated. Same one more problem which I addressed.
Individualistic approach. It depends upon what type of assessors you have got. So all colleges have not got same type. Yeah, that should be a uniform.
Actually, they were asking for the
That is not
no, they were asking for the sample photo. I mean, it was not from this particular, it was not geotech photo. So it was not mentioned.
So this is something, as I said, depends upon the assessor. It is an individualistic approach. discussion where the groups are made and they have been given topics, same topic or different topics, and few of them can present or all can present. Individual activity, something it is just like an assignment that you ask them to do it individually. Then self-directed learning. Now again, which we might not be implemented, self-directed learning means where all the activities and the decisions are taken by the students themselves. They only decide the activity, they only conduct it, they only take the decisions. So that is, they are doing everything. You may be just the observer, the teacher is just the observer. So that is known as self-directed learning, and where they learn the most. They come up with different ideas. So ask you, they have been given all the authorities. आप उसमें अपना टर्म बताओ, जो करते हैं वो उनको प्रेजेंट करना है. So that is what is self-directed learning, preparing charts, which we already do, models, which we make them do, case study, they go to the IPD or OPD and do the case study, concept maps, they make the concept, I told you the diagrams or the flow charts, they make it for your department. So the flow charts, the history of medicine, they can make a complete flow chart year-wise. So this can be done. Or the different schools of philosophy, they can make a flow chart. Then reflective writing. Now see, this is again we are not doing. Reflective writing is something which they have experienced. They write in their own words. Reflective. Say for example, the gait of a patient which they have observed, a particular gait, or say restlessness of a child. Anything, it can be anything. They have gone to the IPD, they have gone to the OPD, and what they have learned, they have experienced, or they have done the case taking, and something, some peculiar or some emotions which were very, very weird. So that's what they have come to know. So they'll write it down about it. That is reflective method of teaching, reflective writing method of teaching. So these are the teachings where student-centric. So you can realize these are student-centric. If he has seen something, he has observed something, and he'll write down, he's never going to forget for his life. Some activity, self-directed activity which they have conducted, they are not never going to forget it for their life. So these are the different methods. Then there is one role play also. Your self-directed is role play also. They play a role. Like one becomes a Naxtomia patient or a Sora patient or a, say like Copodia. So Pulsatilla. So this is how they role play. That is a form of self-directed learning also. Now we come to the integration. One is the horizontal, one is the vertical, and one is the spiral. Now horizontal means subjects of second year only. That is horizontal. Like correlating organon, pathology, materia medica, and forensic medicine. So father of bacteriology, like if you are teaching in organon. Then you can correlate how we had described that cholera are caused by miasmatic animated beings which are plenty in number but cannot be seen by the naked eye. So we had described the bacteria, right? That is the reason why we call him father of bacteriology. Because he had described bacteria staying in Germany and describing about Asiatic cholera, about India's, especially the bank of river Ganges, he had mentioned that. So that you can correlate with pathology. You can forensic medicine, the ethics of a physician. So Organon and forensic medicine, or say toxicology and Organon you can correlate. So that is how you teach different subjects horizontally. Vertically means, as I said, that you take a topic, say you have taken thyroid, you teach anatomy, you teach physiology, you teach pathology, Organon, miasmatic evolution, as well as therapeutics, practice of medicine, the prevalence in community medicine of thyroid. So that portion can be covered by community medicine. So this is how vertical teaching. So whatever Okay, the team teaching, what was mentioned previously. So it is a team where vertically you are correlating many subjects at a time or one or two subjects also. Organon and practice of medicine, Organon and gynecology, Organon and say pathology. So it can be two subjects, it can be many subjects also. But vertical means all years. Horizontal means only second year, only third year, only fourth year. And then comes the spiral. In Organon, for us, this is very easy. Because we can teach it from Organon, we can teach it from various books of philosophy, the same topic. Right? If you are teaching one course, simple substance, if you are teaching medicines, you can teach the different pseudo-sura, this, everything. So, case taking, you can teach it from Organon, you can teach from all three books of philosophy, Robert, Stuart, Luskin, all three. So, that becomes spiral. Or within Organon also, there are many topics which are repeated. Drug proving, it is in the doctrinal part of Organon, in the practical part of Organon. So, within Organon, see, just now I got an example. Say, indisposition. Right? In the footnote of 7th episode, it is mentioned as causa occasionalis causes indisposition. The tight bandage and the incorporated anus and the strong smelling flowers, examples which are given. So, indisposition comes in the footnote of 7th aphorism. 150 aphorism it comes that if you are given a homeopathic specific and if the patient is suffering from some autumnal snuffles, that is indisposition, don't give another medicine if your homeopathic specific medicine is working. So it is 150 aphorism. Again in classification of disease, before that, indisposition is there, that the physician has to remain vigilant that when the indisposition can get converted into an acute disease and you may require prompt action. So see, one topic, indisposition, 7th aphorism, classification of disease, and 150 aphorism. So Organon spiral teaching is very easy. All our books of philosophy has got different susceptibility, different topics which are covered, and that is how you can teach the spiral teaching of Organon, right? This is the same, how to correlate with different things. Now we come to the assessment part, which again in the morning session, how to draw the question paper was very precisely explained to all of you. Now see, this is two types of assessment. There sir had given informative, what form of questions will come in the summative. Formative assessment has got less value. Follow? Formative assessment has got less value. It is just to find out whether the student is learning or not. In your day-to-day teaching, whether the student is understanding and learning. That is formative. You don't take any decisions in formative assessment. Like say he is failing in his periodic assessment. Then you don't say that he is not eligible to go to third year. If he has failed in his first periodic assessment, that is a form of formative assessment. So you don't say that the student will not go to the second year. But summative assessment, it is decision making. It has got more value than formative. Because here it is not that whether the student is learning, here the student has to know. It is the knowledge skill both that he has to know. And only if he passes it, then only he is eligible to go to the next year. So it decides the eligibility of the student. That is summative assessment. Our end year examination which we take. EIE, what we call, or EU, EYU, some say. So this is the summative assessment. So the time to be allotted for the different answers, and how to assess the different, how to prepare the blueprint has been explained. But this is in short, that what I am saying is formative has got less value. It can be conducted after you finish each and every topic also. The form of periodical assessments are also formative. It can be in the form of MCQs, it can be in the form of vivas, it can be in the form of quiz, it can be in a form of debate also. So this is can be conducted. And yes. Yes.
Internals are half-day.
Yes.
We got the internals on their periodic test itself, the Viva exam that we take in their periodic test. So if the student scores less than 50% marks in the internals, he is not eligible to give the final exam. This happened in the Yes. Okay. So we can remedial measures after, if we see that if the first test is bad, then we can see something for that child.
No value? No. It has got less value. So this is and this is the summative assessment. Yeah.
So the subject that formative assessment or internal assessment, both are different. So formative assessment for each and every topic.
It is up to you. It is up to the teacher. It is better if you give for each and every topic.
Here, suppose we have to give MCQ, right? So those are nice. So MCQ, correct student को देंगे तो correct student को MCQ correctly करना है, mark भी देना है, उसका record भी देना है.
This is Google sheet बना दो और उसका फिर प्रिंट आउट ले लो. एक बार करेंगे ना तो फिर हो जाएगा. नहीं, you don't have to write it every time. And you don't have to correct it also.
And we can make on PPT also. We can show and ask them to write on their book also.
Yeah, that is your
After the end of the class, we can make one slide for it.
This is how to practically implement it. That is, you have to find out the reasons. We एक MCQ का काम हमने किया है. दूसरा करेगा. आपका शायद सॉरी महीने के बाद आएगा. इसीलिए तो ज़्यादा टीचर्स बढ़ाने को बोला है ना. By next January, we are going to increase the teachers. See, if you give it is good. If you want to give a grade, it is okay. But if you want to preserve it as a proof that marks तो नहीं चाहिए, तो फिर कैसे decide? Without marks, how will you decide that who have passed in the formative assessment? कितना काम करना, कैसे करना, कितने टीचर्स हैं आपके पास, और आप रखने वाले हैं. It is from college to college.
Because it is when we say integrated, Organon has to integrate it with all subjects. Then it needs more than 5-10 teachers to cope up with this integration which is given in second year only.
That is true. See, Organon and Bhartiya medical these are the two subjects where the teachers have lots of work. Yes. Because I am also a principal. I was a principal for so many years, as well as I have taught Organon for so many years. So I know that we are the ones we never sit. कि अगर आए तो फटाफट दिन में 2-3 लेक्चर्स तो होते ही है. जैसे अभी सेकेंड ईयर कब से नहीं है, तो फोरेंसिक मेडिसिन वाले, पैथोलॉजी वाले तो बैठते ही हैं. Whenever we are like they are sitting and we are going for our lecture, फिर लेके आए, फिर दूसरी बार जा रहे हैं, मोबाइल में आराम से बैठे हैं, वो मग ऐसे वो पाँव फोल्ड करके बैठे हैं, so you feel like how the periodic assessments are to be taken, what marks are to be given, and one only term exam is there. The preliminary exams are not there, and then there is the final exams, and only bylaws are there. So that is something new, something different for us than what we were doing. One more question on the exams. Yeah. Are we supposed to be kept names or no? It is not. NCH has not given us. It is up to you. हमने भी दिया. So see, prelims exams. Again, it is the purview of your university or your college, but the marks will not be counted. Marks will not be counted. First year also, sir, you are constantly talking. I'm very sorry, but you are constantly talking. So, if you have got queries, let us discuss among everyone. Because personal discussions will not help any one of us. We can also gain something from you that will be more beneficial for all of us. So, see, prelims is that it is upon your own purview of your own university and your college. According to me, prelims are must, or not must, I would say necessary. Because the students will also able to judge that what will be the final year style of paper and how much they have reached or how further that they can cope. So it is like good for the students. I feel that it is very rather than teachers, it is good for the teachers. Teacher का वो काम बढ़ता है. फिर से question paper निकालो, इतने question paper answers check करो, copies check करो. So but it will not be counted for their average course. That will not be counted because it is the mandate of NCA, so we can't count it. But your university can decide whether to take the prelims or not. Many of the universities have last year taken. This is already given on the website. The themes are given, the topics are given, and from that you have to draw the question paper. So it is especially important when you are drawing the question paper. I would say that you must take this and sit so that you don't go out of the syllabus and it remains uniform. And this is also very important. Now see, this is the fourth priority. We talked about Bloom's taxonomy, about Miller's, and this is the priority. M&D priority is known. It is known as must know, desirable to know, and nice to know. So that is the MDM priority. So you have to follow that also. Some of the teachers have told me that it is very difficult. That's true. So short answer, because if when we are taking university exams, what sir told in the morning, that if I have got only a hammer, I'll try to hammer everything. So if I'm going to judge by my knowledge, then I may be knowing things which are nice to know, but the students may not be knowing. And this is I have found in many places in Organon. As a PT examiners also have gone to various universities, PhD also. And some German terminology is used. और फिर इसको पता है examiner को, बच्चों को नहीं पता. But then why to use it? They are not supposed. That is nice to know. It is not must to know. So usually avoid asking questions which are nice to know in theory exams. Why you can ask to give them more marks. Score करने के लिए. You want them to become a regular. You may ask questions from nice to know. But theory seems that you won't ask questions from nice to know. It is must to know. Usually must to know. That everyone has to know this. Then you can judge the students. Don't judge by your knowledge. The long questions. You bring and the theme again. This is all given in on the website. So no need to discuss this. This is the marks and 10 marks in that way. This is a question paper distribution. How the aphorisms are to be distributed. Again, yeah, it is given. It is given in the syllabus. The syllabus is there. Then practical and oral. This is the average which you are going to take out. Again, it is there.
Journal that mention only 10 cases, so it is up
Yeah, they have written, so you can divide amount by 5 or something like that. So it is up to you again, because it is not mentioned. It's not mentioned. What is tested in the theory exams and what is tested in the viva. So you are asking questions, see to it that this is covered. This is just common sense which we are doing for so many years. Now see again a sample that how you will assess. This is just like a checklist. Again a sample which is prepared by me, that scoring for your case taking and analysis, because second year that will be the prime thing. Case taking and analysis of the case will be the prime thing in second BHMS. How you will be scoring, how you can, now see this is again as I said, you can prepare according to your own college, according to your university. Here again I would say that there may be certain things which I have missed. It may happen. So therefore wherever I have done, I have written the word sample just to be safe. That this is not final. There can be changes according to your own college, according to your own university. So it's better, what I would say, जो sample का part है, in your board of studies. I am the chairperson of our board of studies, so I had done this. But in your board of studies, you prepare such things for second year. This is only second year, third year, fourth year, and you can put it in your board of studies. Like say for example, if you've got 10 colleges in your university, because your Maharashtra Health University, there are so many colleges. So you can put it there, and then it should go through the board of studies to the academic council, and it should be finalized. So all 10 colleges are doing uniform. And if you are going as examiners to one another colleges, there is no disparity or there is no no injustice to the students. The students everywhere it is uniform. So this is just a suggestion that what we have done, we have got only 4 colleges in our university, but we have made it go to our board of studies. So it becomes uniformly applicable. And whoever is coming as an external examiner to our university, they know that everyone has prepared in the same way. So that is uniform application of it. See, this is the different score, means where you will give marks to your students. The different this thing, checklist. Scoring checklist. This is already we have covered. Again, for oral exams also. Again, a sampled format for oral exams. Description writing, what we do in this thing, in pharmacy, what we teach them in pharmacy. Okay. Again, watch that This is again prepared by this is my this thing, that this is how it can be divided for me. Difficult, again very difficult. Very difficult, but if we want to divide 150 hours, this is what is possible. Taking out all the holidays and all the vacations. This is difficult.
coordinators and the people.
And academic plan is prepared by the calendar is prepared by the university.
Thank you so much, sir. Thank you so much. और बाहर एक्सपेक्ट